Thank you kindly, everyone. Thanks so much for coming. You are such a diverse group of people from across all walks of the healthcare enterprise and consumer advocacy, public service. We're just astounded by the diversity of people who decided to join us. I'd like to start by thanking Ron Inge and his planning committee for putting together a program that matches your diversity in terms of the walks of life and day jobs, if you will, that the people who are joining us today share. I'd also like to thank Victoria Minowitz. She is the person behind the scenes for the Santa Fe Group. She's our executive director. And I get copied on 1 out of every 10 emails that she has, and she's been a very busy lady. So she's in white today. If you see her, please thank her. I'd also like to thank Aegis Communications, Dan Perkins in particular, for agreeing to help us pull the meeting together. So those are the people behind the scenes that I'm pleased to thank. We also have some economic sponsors. Santa Fe Group lives year to year through a group of organizations that support something we call the Founders Fund, and the members of that fund are Colgate, Palmolive, DentaQuest, Dentsply Sirona, Henry Schein, Ivoclar Vivadent, Liberty Dental Plan, Aura Pharma, and Pacific Dental Services. We couldn't do this without your continuing support. Their annual support allows us to plan meetings well in advance. In addition, we have some people who have stepped up specifically to support this salon. We have special benefactors. One chooses to remain anonymous. It's listed as Friends of the Santa Fe Group. GlaxoSmithKline is a major sponsor of this meeting as well. And then we have a half dozen foundations which support us in this event, and that's the Aetna Foundation, the Acora Foundation, the Delta Dental of Iowa Foundation, Henry Schein Cares Foundation, the John A. Hartford Foundation, and the West Health Institute. Those last two are special because these are two of the 5 organizations that are most active in supporting health of the aged. And so it's nice for them to engage in oral health, which has not been a major priority, but both of those organizations have moved in the past few years to become quite active in oral health, and we appreciate their support. This is the moment where I'd normally give you a little bit of background about the Santa Fe Group, but we put that into the program, so I don't need to take any of our precious time today. So, we're all here, I suspect, for slightly different reasons. I mean, we share a common cause, that's for sure, but individually we probably have different interests. And here's mine. This is why I'm here. 5 years ago, I became aware of a paper by Margie Jeffcoat. She was then, had just given up the deanship at the University of Pennsylvania. And it was a remarkable paper in that it spoke about the fact that using data from the insurance industry, she was able to show that people who got dental care had much lower costs of total health care. A key example was diabetes. She showed that diabetic patients who got dental care had an average annual cost $2,800 less than people who didn't. Subsequently, they looked at what happened if they would look at savings from drugs, and that figure went up to over $4,000 per year per diabetic. And it turns out that those savings are driven almost entirely by reduced hospitalizations. So people with non-communicable diseases like diabetes, like cardiovascular disease, like stroke, kidney disease, are basically suffering from inflammatory diseases. And when you add the insult, if you will, of inflammation in the oral cavity through periodontal infection, it compromises the body's ability to manage those conditions. So I said, this is really interesting, but it's a one-off study. It's retrospective. You can't do too much with that. Over the next year or two, I became aware of 4 additional studies sponsored by the private insurance sector, although one of them was actually private insurance data, and the study was done by Marko Vujicic and his group at the American Dental Association, and Marko is here today. So now, and they're showing the same thing, tremendous amounts of savings. It's more interesting. You know, it's probably not a sport. This is probably real. The next thing that piqued my interest was a study by a consulting group, a highly respected consulting firm in the Beltway called Avalier. And they took those first 4 studies and they layered the savings over a Medicare population. What would it look like for Medicare if Medicare offered a modest dental benefit? And it turned out their projections were that over a 10-year period, Medicare would save net of the cost of the dental care, $63.5 billion. $63.5 billion. I saw a note in the news day before yesterday that there's interest in expanding telemedicine within Medicare, and that would save over a 10-year period just about $500 million. And people were excited about it. So here's 63.5 versus 0.5. Finally, I learned, and this was the thing that put me over the top, that the private insurance sector, virtually across the board, was acting on its retrospective analyses. And by acting, I mean if they had a patient who they insured for both general health and dental health, and that patient had one of these non-communicable diseases, they would actively recruit that patient into dental care, and they would waive any fees associated with that. So if the patient had minimums, they'd waive the minimums. If there was a copay, they waived the copay. They did pretty much, and are doing, this is now an industry standard, almost anything they can to get the patient into dental care because they know it's likely to keep the patient out of the hospital, and they know the savings on the other side are enormous. And so, I mean, this is wow, dental care. And this is, by the way, simple dental care. We're talking prophylaxis has this powerful effect, can keep you out of the hospital. The American people should know this. That's why we're so happy that this diverse group exists here today. And the CMS should act on it. We've been working since our last salon here in 2016, have had 4 meetings with the CMS, one with HHS, had a great meeting with the Congressional Budget Office, and they all come away enthused, but we haven't yet been able to take the ball over the goal line. And hopefully, with your help, with the suggestions you're going to be making tomorrow in particular at this meeting, and with new leaders coming into Congress, like the gentle lady to my left, we're going to be successful. We had predicted in 2016 this would take at least 6 years, and I think we could still say on that kind of a timeline. So let me move on now and introduce another member of the Santa Fe group, one of my dearest friends on earth, an extremely accomplished individual. He is a dean and professor emeritus at the University of Southern California School of Dentistry, but he's here today primarily because he served as the director of the National Institute of Dental and Craniofacial Research. He's the person responsible for it becoming craniofacial, dental and craniofacial research. And he was the person who was at NIDCR when then Secretary Shalala decided it was time for the first Surgeon General's report ever on oral health. Proud to introduce Dr. Hal Slavkin.